Good evening, Dr. Chopra. Very nice to have you with us.
Thank you.
If I may introduce you and allow me to say a few lines about you, Dr. Chopra started his life as an invasive cardiologist and trained in the United Kingdom, where he earned his postgraduate degree and the membership of the Royal College of Physicians. Later, he established a very reputed secondary care hospital in Delhi. Over time, he lost confidence in the way mainstream medicine was practiced and finally relinquished that to practice what's popularly known as functional medicine. Functional medicine focuses on disease reversal and solutions to holistic living, where there are no super specialists, but rather super generalists who must know everything about the human anatomy. While doctors at the centers have specific leanings, Dr. Chopra specializes in cardiometabolic diseases like diabetes, hypertension, heart disease, and obesity, including other lifestyle issues, while his team covers the rest. So, Dr. Chopra, functional medicine is now coming in the mainstream. Would you like to tell us what is functional medicine in detail, its theory and practical applications, and what illnesses it addresses, and how is it different from Ayurveda and various forms of mainstream medicine?
Well, functional medicine is a new way of practicing medicine. It's actually mainstream medicine turned on its head, which means that the diagnosis, the anatomy, physiology, and biochemistry we utilize the same knowledge as we use in mainstream medicine. The difference is that we don't use any pharmaceuticals. We use our lifestyle, our environment, nutrition, and our mental attitudes. And we do use a lot of supplements because we feel that as you age and as you are exposed to all these wrong things in our environment, we get deficient in some supplements, so we use that. We also use some bioidentical chemicals and bioidentical hormones, which are not pharmaceutical agents, but they are made from plant-based sources from compounding pharmacies. So that's the basic difference. Now, this is, it started in the US in the late 90s, early this century, and it met a lot of resistance from big pharma, and they horribly opposed it and did a lot of other mean things which I rather not mention. But the point is that today it has become both a social and a universal movement, and I do not think that anybody else can oppose it now. It's a movement is not going to go away. So what is it? Let me first explain the meaning of the word Daivam. Daivam means the unpredictable grace of the divine, which is given to you when you need it, but is delivered to you when you are available to it, which means that you have to rise to the occasion to get it, but it's always there when you are needing it. So, and two of the main tenets in our the word Daivam is both mindfulness and letting go. Because unless you don't let go, new information, new knowledge will not come. So what is it? It's a whole science, system biology medicine, like a roadmap, a new GPS, which is going to navigate you through a new an unnecessarily created terrain of chronic illness. It actually treats not the symptoms but the whole person. It doesn't treat the disease. Symptoms in modern medicine, you have anti-symptom drugs. But what we do is we address the imbalance which produced the symptom in the first place, and the disease will go away as a side effect of the enhancement of health. This is the difference. Okay, so it's a very personalized medicine. It takes genomics into account. It takes into account how our genes interact with our lifestyle, our nutrition, our environment, and our mental attitudes. So what we, in a way, let me describe it in a different way. It's something which restores the balance and harmony of our bioregulatory systems. And these bioregulatory systems are running in your body without your control and command. Okay. So they are a network of interconnected and integrated systems which are dynamically interacting with each other like an orchestra, with the gut as the conductor of the orchestra, and every other organ and physiological and biochemical system is part of the same orchestra. So you see how uniquely they are. So, but in modern medicine, you have the digestive system, circulatory system here. So these systems are not divided by geographical locations in the body or by symptoms or by diseases. So that's the difference here. So we have a whole network of an orchestra which is working, and if one thing goes out of balance, then it is felt by the other person, other organ, right? And if another organ or another system starts to overcompensate for it, then something will fail. So it's a very holotropic way of looking at this, because that means that the whole is found in the part in any case. And if one part goes wrong, it may not show up generally, but we will know that something is going wrong. So this is the one of the basic differences that we say. So it's a medicine of patterns and connections and mechanisms and pattern within the connections. It looks at not the root cause, but the cause of the root cause, right? It looks at where did the inflammation start from, who put the gasoline on the fire, or what put the gasoline on the fire. So it treats the terrain, the soil, and not the plant. It looks upstream for a cause which is presenting downstream as a bunch of symptoms masquerading as an illness. See, for example, downstream you may have some gut issues or some nutritional intolerance, but the cause is due to maybe a mercury poisoning or some candida or some other, or gluten, things like that. So it is a medicine of why, and not a medicine of what, which means why did our body get a command to make cholesterol? Was it due to a statin deficiency? Obviously not. Was disease due to a drug deficiency? And I often joke and say, was erectile dysfunction a Viagra deficiency? So we cannot, use that. That's what mainstream medicine is doing. And what are we doing is, what is the name of the disease, and what medicine is matching with it? What is this irritable bowel syndrome, inflammatory bowel syndrome, chronic fatigue syndrome, autoimmune syndrome? What are these syndromes? They mean nothing. So in our language, we don't even have any illnesses. Because, for me, it is not important whether you have sarcoidosis, TB, or diabetes, or tuberculosis. I will always start from the basic source of the inflammation. So that is the difference. And then trace it upwards. And therefore we go, that's why I said that we have turned it on its head. The roots of the illness lies well below the ground, whereas we are only treating the superficial effects. This is the main difference that we find. So now, there are certain, core imbalances that are present in our body on which we make these systems, right? But before I go there, I want to add a little more line that, the contents of this functional medicine are sometimes explosive. When I talk about it, it sounds very explosive, and it may shock you and then inspire you and finally enlighten you. And this practicing the system is a bit complex. But complex, and not in the pure definition of complex, but complex because it involves a sea change in your motivation, a sea change in what you want to do. Your whole life is completely changed. It's not something that we can change slightly. It's like some patients come and tell me, I can't tell you that I'm slightly pregnant. It's an all or none thing. So what we do is that we have to transform the individual, or rather transmutate the individual. And it literally means like opening your head, taking out your SIM card and putting a new one. But not to worry, it's not that difficult. All it needs that you have to change the way you think, to change the way you use your nutrition, environment, and other things. So it's not an intervention. It's not some injections that we are giving you. You can do it at your own pace. And it is not just done by scientific validity alone. It is how we see, understand, and heal the patient as the patient perceives it. By listening to the patient carefully, imbibing the story within us, making him discover the nature of his problem, and working it on his own pace. So this is the big difference here. So what are our systems? If they're not the respiratory system, this system, what we have done is there's a set of core imbalances which actually form the bridge between the mechanisms and the manifestations of disease. So our systems are, number one, nutrition, the gut microbiome, hormonal balance, inflammation, detoxification, immunity, the metabolic parameters, our structural integrity, our psychospiritual integrity, and our epigenetics. I will talk about epigenetics later because it's a new word. So you understand that now, rather than checking your heart system, kidney system, this system, I'm going to check, where the imbalance took place in your nutrition, what is wrong with your gut microbiome, where is the inflammation coming from, where you need detoxification, what is wrong with your structural integrity. So you see now, is it falling into place? Because we are actually going through the core imbalances that are there, and then we put them together. How does it matter what disease it is? So, for example, I'll give you an example. Celiac disease, which comes from eating gluten, can present as a gastric problem. It can present as autism. It can present as dementia or a thyroid problem. So, my God, what are we talking about? Let's say a guy is depressed. He could have an emotional trauma, or he has B12 deficiency. Either he's not eating enough B12, or he has taken too many of those antacids and he's not making enough B12, or he has a vitamin D deficiency and his brain has gone kaput, or he has taken too many antibiotics and there's inflammation, or he has got insulin resistance. So there are no disease has a similar picture, or no two people are similar. So there is no naming of diseases. I remember one guy who came with us. He had about a list of 20 diseases. He was taking about 30, 40 pills. He had about 5 or 6 doctors seeing him. So I told him, you have a whole list of doctors, a whole list of illnesses, and a whole list of medicines. So now you have come to a holistic doctor. So the whole list has totally collapsed here.
Lovely.
So that is one of the things. I think, are you getting the drift?
Yes, absolutely.
So now what we do is that we have a very unique way of investigating. So everybody has a history and some routine lab tests, but we go by what we anachronically call the 3M, the 4P, and the 5R. So what I mean by that is this is very proactive medicine, and the first thing that we do is measure. Okay, measure. All the routine tests that are done, but we are doing many other things. We are looking at genomics. We are looking at how your genes are expressed. We are looking at what is the nutrigenomics part of it. What is the nutri-technology part of it? We do markers for oxidative stress, markers for inflammation, markers for immunity, markers for bio-waste. So there's so many other markers we do, and we have many other investigative facilities like measuring your body composition analysis. We have a machine which will do what we call BioWell. It measures your auras. It measures how your chakras are running and how the chakras and the auras are connected. And we can repeat them after our treatments and see how, to correct the imbalances. Now, this is a very unique thing. We even have connections with some spiritual agencies like Brahma Kumari's and Aurobindo's mission. What they've done for us is that we gave them all the biochemistry, and they have made algorithms for us of each disease pattern and how many mantras and which asanas and which pranayams will we do for each illnesses. Such details we have gone to. Then we have methods, machines to measure the electromagnetic forces within our system, so that we can give treatments accordingly. We have equipment to check what the artery thickness is, how vulnerable are the arteries, all those little things. So many investigative facilities to bottom of the root cause of the illness. And then this comes the measurement. So with these measurements, we can predict. That is the first part of the P. Then is therefore, when we can predict, we can prevent. And after we've done that, we will mentor and monitor the patient, and that becomes the participatory part. So we are seeing the patient right from the starting point to the core imbalance to the ultimate disease. So at any point, we can catch hold of the illness and treat.
So I have a question here. Sorry to interject. I have a question here. Does functional medicine has any underpinnings in the 3,000-year-old science of Ayurveda, which is now so well respected all over the world? And how does Ayurveda and functional medicine marry with each other?
So, I was going to come to it in any case. See, I have actually studied every discipline of medicine before I got into it, and every means really every. And the only system which appealed to me was Ayurveda. When we talk about complementary and alternative medicines, they are very useful things, and they are very much part of it, including religion, philosophy, spirituality on one hand, and all the alternative and complementary medicines to actually add some tadka to our program. But Ayurveda has it was originated from intuitive discoveries, intuitive experience, which is something so real. Imagine all our gurus and ancient rishis found that this ingredient mixed with this ingredient will do this. And now we are doing it ourselves in a different way. They talked about Vat, Pitta, and Kapha. You see, we can't work in that manner because we are working with the body's biochemistry. But all the Vata, Pitta, and Kapha are taken into account in the manner that I described. When I described our systems, it takes that into account. Also, Ayurveda believes that every illness starts in the gut. So do we. So really speaking, there is no difference. So what we have done is that rather than putting an eclectic combination of Ayurveda and functional medicine, we have fused it to call it integralization. It's not even integrated. Integrated is the wrong word. Integralization means that there is no, eclectic mixture put into a basket and dispensed. It's very uniformly amalgamated. And in fact, I'm proud to say that with your untiring efforts and empowering, help that you've given us, we are the first people to have a fully comprehensive functional medicine center in India, and the only center in the world that will have an amalgamation of functional medicine and Ayurveda. I think that is the greatest boon that we have given ourselves. And
Niraamaya is also very, very proud with this association.
So this is as far.
Yes, please. So
I wanted to tell you.
Yes, please,
that I don't want to be, sort of felt as a traitor to the cause of mainstream medicine, because mainstream medicine is the only thing which saves lives. You've broken a bone, a heart attack, or some transplant, and that has to be done. But it's under attack because of spiraling prices, man-made illnesses, and all biases of self-serving priorities, etc., etc., etc. And they have actually misled us. And I don't want to go too deep into that, but the fact is that we are seriously misled, and I feel bad that we have given wrong advice to our patients for so many years. Yes, sorry, I interrupted you.
No, not at all. So there are a host of healing spas and wellness retreats that are springing up not only all over the country, but all over the world. How is our center different and unique? That's part one of the question. And part two is that how is it different from a usual spa holiday, which people are very proud of? People generally go, they do a few spa treatments, they feel rejuvenated, and they feel healthy. And how are we solving the real life problems of people?
Okay, I'll tell you. See, we have 4 pillars of our treatment, 4 main pillars. The first pillar is disease-proof your life, which is driven by the immunity program. The immunity program makes sure that you don't get ill, and if you do get ill, the illness will fall out like a water of a duck's back. And this is focused on the gut and the mind, because the gut and the mind combined are controlling close to 80 to 90% of our immunity. And in further talks, I will tell you in detail how this immunity program works, but suffice to say that this is our first and most prominent pillar, disease-proof your life. That means when we work so hard, you don't get ill, or if you get ill, you'll recover very quickly. That's the first difference. The second difference is that we are doing reversal of chronic diseases, which means cardiometabolic, which includes hypertension, heart disease, and diabetes mainly, autoimmune illnesses, neurodegenerative illnesses, and even cancers. Now, we are not likely to put cancer patients in this facility, but what we will do is that we will cancer-proof their life, or people who have recovered fully from cancer, we will make sure that they are not getting back to that whole thing again. And we will have very strict, evaluation and criteria for who to bring in and who not to bring in, and that we have a very robust, questionnaire, any very robust software. And you won't believe that this software can cover everything and keep a perfect follow-up of all our patients. So that is the third one. The third one is regenerative medicine. See, regenerative medicine is not practiced in any spa. We have got stem cells and peptides, which we can use, and we even use medical aesthetics, but not aesthetics as in a salon or something. Medical aesthetics which really need it, and we have got peptides which we have arranged from a joint venture with a German and Malaysian company. So that's another thing. And lastly, and not the least, is aging. Now, aging, everybody says you do this, you will have an anti-aging program. But this is a very well-oiled, point by point, a program which will definitely make you live up to 100 happily. See, if you have to live up to 100, you have to be well. But modern medicine, won't let you die. That's the problem. And then they continue, bothering you. But we will make you feel, 60 when you're 100. So aging is one of our very important things. We also use bioidentical hormones and chemicals made from plant-based sources and not pharma sources which have side effects. So I think we've covered a matter which And there's so many ramifications to each. And I haven't talked about mindfulness. You see, we have a primary issue called mindfulness. And from mindfulness, we go to meditation. From there to our yoga, our different pranayam techniques, and our breath work. And we do not encourage any psychiatrists because they give a lot of drugs. And we have wonderful programs which can completely transform your life. And I'm using the word transform, but I would prefer the use the word transmutate, because when you come out of this place, you will be another human being. Your SIM card has been taken away and a new one has been inserted.
Interesting.
That's the thing. You see, and spas have a, it's a luxury thing only. Not that this is not luxury, because people would like to be healed in a luxury product. But this is only luxury. They have their friends along. They're more interested in. So they do learn a little bit. But the moment they go back to their same ways. So this is not a, something that you can put on. It's not like when you become a doctor. That's what they are doing here. We are really going down to the root level.
So I have another question. You said that we are reversing illnesses. Is it safe? I mean, I read it through our previous conversations that 90% of the diseases in the human body emanate from 3 or 4 major diseases, which are primarily lifestyle diseases. And if we can have a control in that, and if we can address that, majority of the life problems can be slowed down, reversed, or cured. And the second part of the question is that, is this reversal for life, and how is it different from the mainstream medicine, and these 3 or 4 major lifestyle diseases? How do you explain to a common man? Because people only go and take a medicine or go to a hospital when they've reached the edge of the cliff. How do you encourage people not to even go towards the cliff?
You see, as I said, our first program is to disease-proof your life. Now, most of our illnesses are based on the nutrition. You see, I'll tell you, we have a pyramid. The base of the pyramid is our structural integrity, how we stand, how our spine is made, what messages our spine is giving to. You see, that is why chiropractic in my dictionary is a more of an holistic science than any other aspect of physiotherapy. So that is our base of the pyramid. One side of the pyramid is made by our biochemistry, what we eat, what we drink, what we breathe. The second one is your mind. And the third one is your toxins and your electromagnetic forces. So imagine this pyramid, we treat it first the base, then one by one each of them. So we have covered everything in this manner. Now, many of the instruments and mechanisms that we have also do a lot of things. After we have evaluated the patient, we have unique IV therapies. Now, again, IV therapies, can I come to this a bit later?
Yes,
what
absolutely.
I wanted to say was that, let's take diabetes, for example. Diabetes is a nutritional illness and it needs a nutritional cure. Now, this is something which is very difficult for people to buy into, because it is entirely the fault of wrong advice, eating number of times, raising your insulin levels, bringing it down. The diabetes is converted completely. Yes, if you go back to your old ways, then you can't call it reversal. But reversal is on the metabolic level. We are not treating sugar in diabetes. We are actually treating the metabolic defect. So once the metabolic defect is treated, you will become 100% reversed. Yes, at that time, you can take a little bit of ease into the strictness, or, if people think this is strict. I don't think it is strict, because I have no diabetes or heart disease, and I've been following the program for more than 7-8 years. Okay. But if you go back to your old habits, obviously it will come back again, because it's a dietary illness and it needs a dietary cure. So reversal will be complete, that I can assure you. But you have to stick to it. But once you do it in a way, and you do it in a manner that you have really let go and done the whole job, there is no way when you will stop it yourself.
Lovely.
So I wanted to tell you about certain treatment modalities that we have, the IV therapies. See, the IV therapies, have got sometimes a bad name, that only the big daddies and all the celebrities do that. Yes, there are things like jet lag, facial glow, general illness, but the IVs that we have are actually either putting together a lot of minerals and this thing to raise up your immunity, We have IVs for treating, maintaining post-surgical things. We have IVs for aging, certain mechanisms we use, and all these are not pharmaceuticals. We have IVs for treating all the neuronal defects, neurodegenerative defects, and every material that we use is not a pharmaceutical agent. As I said, it's all made by our own body.
Very nice.
Then we have ozone. We pump in ozone. We can give ozone intravenously from the mouth, from the nose, intrarectally, intravaginally. We have ozone baths and ozone pods where we can put people in. Metal toxicities and mineral toxicities, we have, we give the IV therapies to chelate the metal out. Chelating means leaching it out from the body, because otherwise there is no method of doing it. Then we put people in infrared saunas, far infrared saunas, near infrared saunas. The temperature goes so high that the metal comes out. We give some IVs, you pee the metal out, and then we put you into a hyperbaric oxygen chamber. The hyperbaric oxygen chamber gives you 3 atmospheres of oxygen. Even sitting there for 1 hour can give you more oxygen that you can get in a few months in our cities. And then we have light and photodynamic and sonodynamic therapies, flotation tanks, so many wonderful things that we can keep adding on and on, depending upon how much space we have. And we definitely will. So these are unique therapies, unknown to most people, and I don't think any other spa in the world has this.
Lovely. So one thing, again, for a very, very common man, or rather for the common man, the understanding of how just a few lifestyle diseases lead to a whole host of other complicated problems and precipitation in your anatomy. Would you like to just say a little bit more about that, Doctor?
What I did mention is that these 4 aspects of our pyramid, when we can approach them and look into the depth of these 4 things, there is no way we cannot solve it. And the fact that we go to the root cause into the inflammation which started the problem, what is there to stop us from treating the whole illness? Does that answer your question, or should I elucidate further?
No, it does. But maybe not. If I may just try and rephrase my question, Dr. Chopra.
Yeah.
A person living in the hinterland, unless he really gets a seriously life-threatening disease, which happens there as well, those people are generally healthier than the people who are living in the cities. Which means most of the problems that are happening to people who are living in urban cities emanate from all the lifestyle issues. And those lifestyle issues are primarily 3 of them: hypertension, diabetes, blood pressure, mental health, and cardiometabolic diseases, right? How are we?
So you see,
So how are we addressing that?
No, the mechanism is the same. If you, in our further talks, I can go one by one in each of the major cardiometabolic.
Yes,
I have in fact in my mind picked up that in our next meeting we can talk purely about diabetes, how it is reversed. Now, talking about people in the hinterland or in the people, they are not exposed to all these toxins. They're not exposed to modern foods. They're not exposed to processed, packaged, and preserved foods and all the toxins. Even the fruit that we eat is so poisoned from the soil. So those people are not used to these things. So that's why they don't suffer so much. But it can be, what you're trying to say is that we can put it through any level, from the hinterland level to the guy who's sitting in the city who doesn't have time to think. Once we put him on this program, he cannot change it. It's so compelling.
So Dr. Chopra, what are the investigations that we do, and what are the machines that we use in functional medicine?
You see, first of all, as I mentioned, that we have a very robust software and we have a plan of how each person's history is taken. As I said, it is very personalized, and we measure not just the routine laboratory test, but we measure markers of all the tenets of our mechanisms that I told you. That means about nutritional markers, inflammation markers, immune markers, oxidative stress markers, metabolic markers, our psychospiritual integrity, our structural integrity, all have separate markers. And we can measure them, and therefore we can use them as a baseline to compare that every 6 weeks, 3 months, we do it. Because, and then when the patient comes in, we do his body composition analysis. How much fat is in his body, how much fat is surrounding his viscera, that is organs, where is his muscle more, where is muscle less, what is the density of his bone. Then we talked about the biowell apparatus, which does the chakra balancing and the auras. Then we have measures for taking the integrity of your blood vessels, how much of pressure you are putting on your foot in the diabetic, how much of nerve pressure is missing. So there is no aspect that we leave behind.
So if I may ask, are these investigations invasive in nature and very complicated, like going to a hospital? How do we investigate?
See, the normal blood tests, what we normally do is when the
Yes.
patient comes to us, we've already done the routine blood tests that we all know about.
Yes.
And then we also add a bunch of investigations which nobody has ever done. Then when you come to the facility, then we use these ones. And none of them are invasive. And all of them take about 2 minutes to maximum 15 minutes.
So these are very specialized machines.
Very specialized machines, and they have to be created. And we have already talked about all this, and we have very generously put so many nice places for us to fit these places in.
Lovely.
So this is not a problem at all. So you see, we can't even compare it. We can't even compare it with any routine spa, because there's nothing that because there and the programs will be so well done, and we will supervise every day what you're eating, what you're doing, how are you meditating. There is nothing that we will leave behind, and we've got a whole sheet on the person of how he is and how he wants to be.
Fantastic. Dr. Chopra, thank you for your time and for introducing us to the fundamentals of functional medicine. We look forward to more such sessions with you. Perhaps next session, we will cover the reversal of diabetes through functional medicine. Thank you very much. Stay healthy, stay safe.